Kind of fun to have you here. Tonight we're going to be talking about...
How are you? That's right, yeah. Well, she used to be in the ward. Yeah.
a health issue that a lot of people deal with called anxiety. Okay? When we talk about anxiety, we look at anxiety as a neurologic or a brain-based imbalance. Okay? And the big imbalance that we'll find, and we'll talk about this imbalance, so we'll call it a neuro imbalance. Let's talk first about symptoms of anxiety. Okay? Symptoms of anxiety, most people will describe as a racing heart, or pressure on the chest, or a loss of breath, or difficulty breathing, and often will be associated with events or situations, or sometimes at night. It awakens me, this alarm, this sense of, oh no, an urgency. And it becomes then a major disruptor of sleep. A lot of people that suffer from anxiety have very disrupted sleep. A lot of people with anxiety will also experience, because of the difficulty breathing, numbness in the arms and hands. And then a lot of people, again, the primary thing they will describe as pressure, chest pressure. Okay? Some people have even described their symptoms of anxiety as heart symptoms, and they'll actually go to an emergency response team and ask them about these symptoms of chest pressure, because it will mimic heart symptoms. Okay? So you can imagine when a person is experiencing an anxiety attack, if you have difficulty breathing, difficulty regulating your heart rate, and you also experience chest pressure, how those symptoms could be very alarming to a person. Okay? And if you find this to be the case, so difficulty regulating heart rate, what a lot of people will say then is, it feels like it becomes a disability almost for me, because I don't know when it's going to be triggered. Or some will say, some young people that I've seen will say, I get test anxiety. When the teacher says, oh, time for the test, they forget, and then they start to feel this pressure and this emotional angst worked up, and they can't function. Okay? I've seen people who have had anxiety where they describe their anxiety trigger as dealing with other people in business. I've also seen some cases where people have dealt with anxiety, and their big symptom has been this heart rate that's so rapid they can't get it to calm down. Bless you. So
they come in sixes, so you can stop blessing me.
We'll just bless you then, or at least try.
Yeah.
So one lady that had come to us had a resting heart rate. When she was sitting in the office, her heart rate was over 120 beats a minute. Okay, normal resting is about 68, 72. Hers was 120 plus. When she came, though, she had experienced some severe symptoms of severe depression and was actually suicidal. So we kept her there with us until we got a hold of her counselor, but we actually gave her a nutritional recommendation, and within a half an hour had her heart rate regulated again. So I'll actually talk about this evening a couple of things that we look at that help with the neurologic imbalance and the brain-based imbalance. Okay? Does anybody have a question about that, or some relationships to that, or anything that you'd like to talk about specifically that you've dealt with as far as symptoms? Okay?
Recently, beginning of this week, what is this, Tuesday? I guess last Thursday I went in for an MRI. And they forgot to give me the thing to communicate.
Right?
And I had an anxiety attack, my first one I ever had, inside that MRI machine.
Yeah.
And I go, why come this is going so long, And the gal on the other side of the counter, kicked a bucket or something. And then I got all flustered, my heart went gene. I had to breathe to keep up with it. And it was terrible. So the only thing I could do is wiggle my legs. So I stuck my legs up as high as I could, shook them. And they come running out. God, it's
Get me
terrible.
out of here.
It's like being buried alive. That's what I felt like.
Yeah,
I
absolutely.
couldn't scoot out. I couldn't do nothing.
Right, right. Anybody else? Jim?
Yeah, I had my first one last spring,
Uh-huh.
but I woke up from my sleep, and I was frozen, and I couldn't move a limb.
Mm-hmm.
And it's like, I was sleeping. How does that happen?
Right. Right. Anybody else?
I don't know if it's anxiety or not, but I've had a couple of times where I'll just startle awake
Okay.
and almost think I saw somebody there, but not really. But then I just go right back to sleep. Is that anxiety or is that something completely
That's something different.
Okay.
Okay, so a startle response is going to be different than the anxiety, because usually with the anxiety you'll feel this overwhelming sense of peril or doom,
Mm-hmm.
and then there's just a lot of pressure and then inability to catch your breath.
Mm-hmm.
A lot of times when we see startle
Mm-hmm.
or a recurrent rapid alarm response,
Mm-hmm.
that can actually be associated with an adrenal response.
Mm.
So when I have a severe hypoadrenia, my cortisol isn't able to bring up my
Mm-hmm.
blood sugars during the night, so consequently I'll get this intense startle response because the adrenaline will kick in, which will cause then my blood sugars to come back up.
Okay.
Okay?
Yeah, because it hasn't happened since I've got my adrenals fixed.
Isn't that neat?
Yeah, so that makes sense.
There you go. Very
Okay.
good. So when we look at these types of scenarios though, the common treatment for anxiety in the prescription world is a special one called Xanax, right? You familiar with that one?
Mm-hmm.
And I may spell this incorrectly. I'll be honest with you. I just know how to say it. Okay, Xanax. Another is sometimes given as a lithium to just kind of really calm the system. And that one's more common with paranoia and anxiety, severe. Okay, Haldol is given with paranoia and severe anxiety, but the most common one that we see prescribed presently is Xanax. Okay, in our office we try to look at this though again as more of a brain-based neurologic imbalance. So let's talk about that for just a moment. Everybody okay to this point? Okay, so let's look at then, based on those symptoms, how can we help? And I've had several people literally in the office with an anxiety attack that have had this elevated heart rate that's just way above. I had one gal, hers was at 140, and she's just going. This intense pressure. And so in our office we have to look at things from a different point of view. What we look for, first of all, is the neurotransmitters of the brain have specific responsibilities. There are different types of neurotransmitters. We've talked about before dopamine, and this, I'm just going to kind of list the neurotransmitters first and then kind of tell you how we approach this. We've talked about dopamine and the need for the body with dopamine. Remember, a lack of dopamine in the system is that tremor and the difficulty moving, right? We call that Parkinsonism. We look at acetylcarnitine or acetylcholine, acetylcholine, and acetylcholine, ACH, is our sympathetic parasympathetic system primarily. And a lot of the autonomic or automatic functions of the body are based on ACH, acetylcholine. Boy, it's kind of difficult writing on a tripod compared to the wall. But acetylcholine transmitters. Okay, so we want to look at acetylcholine then as the sympathetic, parasympathetic, pre- and post-ganglionic stimulation. We look also then at the neurotransmitter called serotonin. And a lot of people are familiar with serotonin reuptake inhibitors such as Prozac. Exactly. So the antidepressives. So the serotonin is another key just for mood. Okay? And then the final one that we'll talk about this evening is one called GABA. Gamma-Aminobutyric acid, GABA. You just keep it simple. Okay? But GABA is the neurotransmitter that gives the brain the sense of satisfaction. And we'll see then, most commonly with anxiety, a lack of GABA. Okay? So, dopamine,
Will you say what GABA is again?
gamma, let me just write it for you.